It's Nurse Sewell here with Evolve Wellness and Aesthetics here in Carrollton, Texas. I'm going to go live today. I have not been live in a few days, so I have been a little bit off schedule, but I said I'm going to go make it a point to do it today in the rain. So I'm hoping everything goes right because I'm, kind of doing this by myself and getting used to all this technology and stuff. Well, today I want to talk about another service that I offer at Evolve Wellness and Aesthetics, and it's called pre-surgery clearance, preoperative surgery clearances. And what that is a clearance or a physical almost for people who are interested in cosmetic surgery. They have to go and they have to get a release or maybe like a physical for cosmetic surgery. And so what this is, it's like a clearance. So what happens is the person who wants to have the cosmetic procedure, she will talk to or pay for her procedure or her deposit, depict her doctor out and all that good stuff, and then he will then send her the test that he wants her to have. And then once he sends her the test and they get everything confirmed, then they find someone who's going to do the pre-surgery clearances. And that's where I come in at. So the pre-surgery clearance consists of me getting your blood pressure, getting vital signs, and basically getting baseline labs for the doctor so that we can see if you're a good candidate for this procedure or not. So, so while we're doing that, it's an easy process, a simple process. You bring the paperwork in, we fill it out, turn it in, and they do your CBC, we do PTT, INRs, we do pregnancy tests, we test your hemoglobin, your hematocrit, and if you're over certain ages, you may have to get an EKG. If you have hypertension, if you have any type of heart murmur, or if you're getting breast surgery done, you may have to get mammograms, chest x-rays, and things of that nature. So that is where, and I send you out to get that done. But here in the lab, here in my clinic, I will be able to do the EKG for you, and I'll be able to do all your labs. So that is what a pre-surgery clearance is. So again, you have to have this type of clearance and everything sent in to your physician so that you can go ahead and get approved to have your surgery. So that again is called pre-surgery clearance, pre-operative surgery clearances that I do here at Evolve Wellness and Aesthetics. And again, the new Mia Aesthetics is 9 minutes away from my clinic, so that is an advantage of being able to, come here so that you're close to your doctor if you're going to go to Mia Aesthetics here in Dallas. So let's talk about it. So many people have, so many things to say about these type of procedures, but I'm not going to be ashamed to say I am a person who's had this type of surgery done, and it's something that I wanted to do. I didn't really tell a lot of people because I didn't want a lot of opinions. And you need to be prepared when you have this type of procedure. You need to be prepared that people are going to have an opinion. People are going to have good things to say, and people are going to have bad things to say. But at the end of the day, it's your choice. It's what you want to do, and you can't worry about everyone's opinion because everyone has one. I mean, I've had people, like even my own family members, they talk to you about, oh, what did you get done, this and that, and then they go and talk about you. So it's just, it's up to you and what makes you happy. If you don't like something, go and change it. So that's what I did. I went and I did it. I had mine done. Years ago. I love the outcome of it. And just like a car, when you buy a car, you have to continue service on your car. So when you go and get these procedures done, it's not like you're going to be able to sit at home and you had this procedure done, you can sit at home and eat what you want to eat and not exercise, and you're still going to keep those same results. That's not how it works. Just like you maintenance your car, you have to maintenance your body. So I had this done in like 2019, and I still get massages done, which is very, 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 very important after you have this type of, if you have a BBL 360, any type of lipo, it's very important to get massages. I can't stress that enough on how important it is to go and get a massage. But the most important thing is when you go and you get a massage, you need to do your due diligence, to do your research on, first off, who's going to do your surgery. Everybody, is not licensed to say they're going to do the surgery. They're not licensed to do it. So you need to do your research on who's licensed to do it. How many deaths do they have? What are their outcomes? Do they do big people, little people? You need to do your research on who is the best person for you and the safest person for you, who you want to go to give you the results that you want, and make sure that you come out, as we say in the surgery world, you come on you're on the other side, you're on the flat side, is what they say. So you need to find that out. Who is the doctor who you want to perform that surgery? Then once you decide who the doctor you're going to go to and you get your date, that's when you need to find you a massage therapist. And everybody can do massages. It's so many people out here to do massages, but are they licensed? Are they licensed to do this type of massage therapy, lymphatic massage therapy? Doing a massage is different from doing a lymphatic massage therapy. It's very, very different. And you want someone who does a lymphatic massage that is kind of based like the people who do the massages that are in Miami. Not just, they need to know how to mold your body, because that is what the surgery does. That's what the massage is for. The massage is to push fluids and get them to go out of your body, either through your incisions or through your lymphatic drains, and which is in your arm, your legs, in the certain areas that they are. And you need to find a lymphatic massage therapist who knows exactly what they're doing to help mold your body so that you can get the best outcome of this surgery. And plus, you're going to be all swollen. That fluid has to go somewhere, and you want it to go in the right direction and out of your body. So, like I say, first you need to do your research on who you want to be your doctor to do this surgery. Then you need to find someone who's going to be licensed to do your lymphatic massages. So you need to have, everything needs to be lined up. When you have your surgery, and once you go and after the surgery's done, you go to your post-op appointment, you need to have someone there to start doing your massages that day. And normally in Miami or wherever, they make you stay 5 days. They make you stay 5 days for a reason. I know so many people who go down there and they say, oh, we're only going to stay a couple of days and this and that. You want to be down there because if something happens to you, you're in Miami. The doctor who did the surgery is in Miami. Or if you're in Dallas or you come here to do the surgery and you don't live in Dallas, you need to stay your time, because once you get through with that surgery and if something happens and you go back home to wherever that is, another doctor does not want to work on someone else's surgery. No one wants to go behind anyone. That's just like beauticians. When the beauticians say, hey, I'm not going to go, and they're not, if you don't buy your hair from them or if you don't get your sew-in, they're not going to maintenance someone else's sew-in, because no one wants to be responsible for someone else's work. So it's important to go down there and stay your time, stay the days that it's time for you to stay. So many people like to just cut corners in this, and I just think that coming from someone who medically trained someone and someone who has also had this surgery done, I think it's best to follow the instructions that the doctor gives you. It's not, sometimes it's okay to cut corners in certain things, but when you're dealing with your life and you're dealing with all this, these surgeries are not cheap. You're paying your money for these surgeries. You want to make sure that you follow the directions, and you want to make sure that your outcomes are what you want them to be. And another thing about outcomes, let's talk about this. Let's have realistic expectations. You cannot go down there and be 500 pounds and think he's going to snatch your body. That's not how it's going to happen. Be realistic when you're going and you're getting ready to have these procedures. So that way, the more realistic you are, that's the best way you're going to be able to find the physician who can do that surgery for you. Some physicians are really good with smaller body frames. Some people are really good with people with bigger frames. And that's where the BMI comes important, knowing your BMI. And they will tell you that once you call your coordinator, they'll go over your BMI. They may tell you need to lose some weight, you need to gain some weight. Whatever the case may be, it's important for you to do your research on finding the physician that's best for you. And like I say, this is not a surgery or anything that you want to cut corners on. You want to do things the right way so your outcome is still really good. You want the best outcome for it. Because when you go through this is not easy. This is not a lightweight, like you're going to get your teeth pulled. It's not like that. This is something that you would like to have, and it is sometimes it's hard to bounce back from. And I tell people, like I say, when you get ready to have your surgery, you get everything done, you get your date, go ahead and start booking your massages. So that way you can have your massages booked wherever you're going to have your surgery at. As you said, you're going to go to Miami. You have your surgery, your massages is booked already for those 5 days. So you're going to know that before you go home, you're going to have 5 days of, massages. Then when you get back home, you need to have someone back to where you live at who can do these same type of massages on you, because you're gonna need like at least, I went twice a week, and I went for like 5 weeks. I did a package deal, and I maintained in my faja, and I did everything by the book. I'm very by the book when it comes to doing certain things, especially when I'm spending my money, and especially when I know the outcome that I want and the look that I'm going for. So I tell people this, plan ahead. Stop waiting to the last minute. Stop trying to get over. Stop listening to what other people are saying who have not had this procedure done, and not listening to what the doctors say. Stay your time down there just in case something happens. Because what if you get an infection? What if the drain comes out? What if you're draining too much? What if your hemoglobin drops? Anything can happen. It's just like this is a major surgery. It's not like you're getting, like I said, you're going to the dentist to get a tooth pulled. So you need to be down there where your doctor is, just in case something happens, that doctor can go back in and fix whatever needs to be fixed. Like I say, it's really hard to come back home and find another doctor who wants to work on someone else's work. And I can totally understand that. No one wants to work on, even if a cosmetologist does not want to work over someone else's work, why would you think that a physician wants to work over someone else's work? It's not good, and it's going to be a hard process for you to get the help that you need and the treatment that you need if something is wrong. So that's my spiel about having surgeries, and then just not taking the easy way out, not trying to cut corners when corners don't need to be cut. You need to go down there. You need to stay your time, do what you're supposed to do, have things lined up while you're down there, have things lined up when you get back. When you get ready to go down there, it's okay to fly on regular flight. But when you come back home, you can't sit on if you're gonna be billed, you can't sit on your butt. So when you go back home, hey, you need to go ahead and you need to go back home first class. So that way, it's only 2 people on that row. So that way, you can get on your knees when the flight attendants them says you can, unbuckle your seatbelt. You can get on your knees, put your head in your pillow in your chair, and you don't have to sit on your butt. It's hard to do that when you're not sitting in first class. So you need to think about things to get things scheduled and get things prioritized so that you can have, like I say, the best outcomes and a good experience. Another thing I want to talk about is, like I say, a licensed physician, a licensed massage therapist. Just because they can do massages, they don't mean that they can do lymphatic massages. So you need to do your research. People look people up all the time. It's a website you can go on. You can look up any RN license, any physician license. They have their massage therapy license. You can go and look all that up. And you want to go to someone who is licensed. To do that. And as a nurse practitioner or RN, I'm not licensed to do lymphatic massage therapy. I'm not licensed to do that, and you won't see me doing that. It's called staying in your scope of practice, basically staying in your lane, in the lane that pays you, and in the lane that you are safe in. Because when you go outside of that, that's when you get in trouble, and that's when lawsuits start to come, and that's when things don't start going right because you get your hand in doing things that you're not authorized or licensed to do. I'm not a massage therapist, so you won't see me doing any type of lymphatic drainage or anything like that on anyone. Now, can I drain a seroma? Yes, I can drain a seroma. That's in my scope of practice, but it's not in my scope of practice to do a lymphatic massage therapy on you and start pushing fluids or putting a needle in your body and pushing fluids through that needle. I'm not licensed to do that, and I'm not going to do that. So you need to stop. People need to stop going to people based off the hype or because somebody else said go. Look it up yourself. Do the research yourself, because it falls on you, on who you go to and who you're giving your money to. It might take, people, they're going to take your money if you give it to them, but you need to do the research and see, are they licensed to give you this care? Because you want the best outcome. Okay, next, we talked about doctors. We've talked about massage therapists. Let's talk about these recovery homes. It is so, this is back in, I'm back in 2019. I'm a vet at this. So this is back in 2019 when I went down there, didn't tell nobody, but my son went down there and all that good stuff. And, I think that people just have this negative look on, and everybody does this. Surgery is just like, it's a big thing now. So many people are doing it. I'm not ashamed to say that that's something that I did. I was unhappy, and what I was unhappy with, I changed it. But I just want people to understand that it's easy to go down there to get this done, but to maintain it, that's the hard part. So, when people are so quick to judge and say, oh, this and that, that and that. But when you come back home, that working out, that eating right, That's an everyday thing that you have to continue to do to keep your results. You don't just go down there and boom, you ain't got to never eat again. You'll never get to exercise again, and your results are going to stay the same. That's not how that works. You have to put some work into it, and it's all the time. Like I say, I'm going to say it again. It's just like buying a car. You have to keep maintenance on your car. If you want your car to continue to run and do what it's supposed to do, you need to do that to feel that same way about your body. Continue to give your body the protein that it needs. Continue to exercise. Continue to do the things that you need to do to maintain the look that you want to look. That you want to have, and that you paid for. You spend a lot of money for this. So let's just talk about the recovery homes. It's a lot of people who go and have these surgeries. A lot of dolls is what they call them. Dolls is what we call ourselves. Because I'm a doll myself. So we call ourselves dolls. And these dolls, they go down there and they think that because they have had this procedure done, that they have the knowledge, which they do have some of they have the knowledge of experience to say that they're going to have a recovery home. And I think people get caught up in the aesthetics of things. People go down there and they're in Miami, and a lot of Spanish speaking people are down there, and they have these big pretty mansions, and they have these pretty pictures that they have on social media, and then they have these pretty plates of food that they're going to serve you and all this type of stuff, and you get caught up in, I'm recovering at a mansion. Listen, as a nurse, because I was just an RN at that time, I could care less if I was in a mansion. That was the last thing on my mind. I wanted to be somewhere where someone was licensed, had a license, knew about a license in medical, a nurse, someone who knew the signs and symptoms if I was to be ready to crash, or if my hemoglobin was dropping, or if I needed fluids, or who was going to be able to call 911, who was going to be able to contact the doctor. Don't go to people just because, hey, the old saying is everything that glitters is not gold. And that's the same way in these recovery homes. And they trick people in, they're at a mansion. Who cares at a mansion? You want to have good care. That's what you want. You want to have someone who knows what's going on and who's going to care for you. Not just someone who says, I've had the surgery before, so I know what you need. No, that's not how that works. I went to someone who had a licensed RN license. Even though I am a nurse, and at that time I was just a registered nurse, when I had that procedure done, I lost all train of thought. I was no longer a nurse. I was a patient. I was a patient. When you start to have these type of things done, or any type of procedure done, or whatever the case may be, you switch roles. You're no longer thinking as a nurse, especially as soon as you come out, you're thinking as a patient. That's what you're thinking as. So you need to have someone there who's going to do that thinking for you, and who has the medical knowledge of what is going on. So stop going to places that don't have licensed personnel in there working. You don't want someone there who does not have a license, someone who does not have a relationship with the surgery center, someone who does not have a relationship with the physician who's going to care for you. If something happens, you want them to know what to do, or to see the signs and symptoms coming before they actually happen. So I think that's important for people to understand, and stop going about how things look and go to people who are licensed to take care of you. If they don't have a license, they don't have any business to have a recovery home, and they don't have any business taking care of someone else who just had surgery. Anything can happen, and I see so many horror stories of people going to Miami, and they're in these recovery homes, and they had people who didn't understand what they were saying, and the house was nasty and blood was everywhere. But the house looked good on the outside. You were in a mansion, but you were getting treated bad. People weren't there with the knowledge to care for you that you needed to care for you. So if you're not going to go down there and stay in a recovery home that has a licensed personnel, take you someone in there with you. I know a lot of people who I see on social media, they go and they travel. They're travel nurses, and they go with the person who's going to have the patient who's going to have the surgery, and they stay there and they take care of that person. But so many people, I'm going there and I'm going to stay at Airbnb, or I'm going to stay with my boyfriend. Listen, when you go there and you go through all this right here, your boyfriend, your husband is not going to want to take care of you, and you don't want to put that burden on them. Don't do that. I just feel like, it's a burden on to people who are not really medically trained for that. So again, I say, when you're going to do something, don't half-ass do it. You know, you save the money to pay for the surgery, pay for the recovery as well, because the surgery is, like I say, it's the easy part, and that's the cheapest part. The recovery, the massages, the food, the continuing exercise, and the fajas, all that is way more than paying for doing the actual surgery. That is the easy part, the surgery. So I'm going to say again, when you're having your surgery, make sure you're going to stay somewhere with licensed personnel, or have someone who go down there with you who's a licensed nurse or a nurse practitioner, or who knows what to do if you start to crash. Get you someone who's a licensed lymphatic massage therapist. Not a massage therapist, but you want them to be licensed as a lymphatic massage therapist. Number 2. Number 3, like I say, talk about the recovery homes, and then doing your due diligence about finding the doctors who you need to go to. Stop just going in the doctor because they're throwing a special. Go back and see, do they have any deaths on them? Go back and see, are they even licensed to even be performing this surgery? People, you don't understand, what doctor should I go to? What this and that? Do the surgery, do the research yourself. You have to research this. It's not just I wouldn't just let anybody, just work on your car. You're going to make sure you're going to go to someone who's going to give you good results. So why would you let just anybody work on your body? This is a very extensive surgery. It's not just like a IND or like a laceration repair. You're having surgery. This is like an invasive, process. So just make sure that you're covering, you're covering all your bases, and you're looking at everything. And I'm not trying to scare anyone. I just want people to know, stop going and giving your money to these people who are not licensed to take care of you, and then you don't get the results that you want. And that's because you didn't do your research in the first place. The blame will be on you and not on them. So let's talk about this. This is another thing that people need to understand about your hemoglobin. So what is hemoglobin? Hemoglobin is protein in red blood cells that carries oxygen. It binds with oxygen. Hemoglobin is very essential for transferring oxygen in your blood from the lungs to other tissues in the body. So what that is you need your hemoglobin to be at a certain level. That's how come they want your level to be at least 11 and above. So when I'm anemic, so I knew my hemoglobin always runs low. So since I knew that, and I had my surgery day picked for, or whatever I had my surgery day picked for, I started taking Floridex and Hemoplex for iron. I started taking iron, and it was, like I said, I'm gonna say it again, it's Floridex, Hemoplex, and you can get them off Amazon, you can get them at a Vitamin Shopping, and you take these every day. So I started ahead of time because I already knew that my hemoglobin was going to be low, and I wanted my hemoglobin to be high. I didn't want to go down there and they turn me around, or I get down there and I bottom out. I didn't want any of that to happen. So you want your iron to be at a certain level, and they're not going to take you unless your hemoglobin is at a certain level. But people don't understand what hemoglobin is. It's bringing the red blood cells, bringing oxygen to the body. And you need that. Just imagine just not having oxygen going to your lungs, oxygen not going to your heart, oxygen not going to any other organs in your body. That's the importance of the hemoglobin. So that's why you want your hemoglobin to be 11 and above. And then that's why you should, if you know you're anemic, go ahead and start taking Hemoplex and Floridex ahead of time. Their regular iron supplements, I'll tell you right now, they didn't do anything for me. But sometimes, people, a lot of nurses, they do offer IV iron infusions. You can start that as well. Maybe take a couple of those before, you're ready for your procedure if you know that your iron is going to be low. So go ahead and just kind of, like I say, this is not something you just jump into. And especially if your hemoglobin is low, start ahead of time. Start planning ahead of time. So the signs of low hemoglobin is you're going to have an increased heart rate, shortness of breath, chest pain, you may become pale, fatigue, and weakness. So you need someone who's going to be there and who's going to know all of this. You need someone who's going to know all those signs and symptoms. And they don't know those signs and symptoms, how can they take care of you? Just because they were a doll and they've had that surgery before, why would you trust someone who's not educated to know those signs and symptoms to take care of you? No, that's not how that works. You should not go to any place that does not have any licensed personnel to take care of you. So, like I say, when you come to me for your pre-surgery clearances, pre-operative clearance, however you want to say it, the doctor will send you the labs that they want you to take. And like I say, this CBC, PT, INR, PTT, your CMP, they're going to test you for pregnancy, they're going to do your HIV test, and then EKG if you have hypertension or heart murmurs or you're over 50 years old and plus. Sometimes we do the chest x-rays for patients who are 40 years old and plus or who have asthma. Mammograms for people who are 40 years old and plus and who's going to have some type of breast augmentation or something done to the breast, have some type of breast surgery. They're going to do that. So that is what a pre-surgery clearance is. So you come in, I'm going to assess your body. And another thing, and I learned this the hard way, you cannot have any type of IUD or any type of anything like that. You could take blood, you could continue your blood pressure medicine and everything like that. I'm not blood pressure, but I mean your birth control. But any IUDs, any Nexaplon, any of those, you can't have any of that type that are going to do surgery on you with those in your body. So I'm just going to let you know that now. They're going to turn you around. So before you go to Miami or anywhere, if you have any type of IUDs, any arm insertions, any type of implants for birth control, you're going to have them removed before they would do the surgery on you. So just to save you a step, so you'll know before you go down there and it happens. Also, smoking. They don't want you to smoke for at least 30 days before you have your surgery. Smoking stops the wound healing. You have to stop smoking. You can't smoke at least 30 days before the surgery. Especially even still smoke weed. You got to stop smoking weed. I mean, I think you can still smoke cigarettes, but I think it's a time frame that you probably need to stop before you do. Because like I say, all that smoking, that affects your wound healing. And when you get down there on the day of, they're going to do a drug test on you. So if you're negative for weed or whatever the case may be, I don't care, if you're, touching it and it's in and you didn't use it, if it's in your system in any type of way, they're going to cancel your surgery. You're not going to get your money back. They're not going to refund you any of your money. So with that being said, plan ahead for those type of things that if you smoke weed or whatever the case may be, I'm giving you heads up what's going to happen and what you need to do. Stop ahead of time, because when you go down there, they're going to do it that morning. They're going to do that drug test, and if it comes back anything, they're going to cancel, no refund. So again, I just want to come here and say, Evolve Wellness offers pre-operative surgery clearances, pre-surgery clearances for patients who are going to go and have cosmetic procedures done. Like I say, Mia Aesthetics, the new one here in Dallas, it's only 9 minutes away from my office. So that's a good thing, to be very close to where you're going to have your surgery center. I'm going to be able to, I can do your EKG, I can do all your labs, I can do the physical and everything. But if you have to have a chest x-ray or a mammogram, I will have to send you out to get that done. But other than that, those are the services that I can offer here at Evolve Wellness and Aesthetics as a licensed nurse practitioner. That is what I can, that I offer. But I just wanted to also just kind of go over some things, because as being someone who's previously had this procedure done before, I just want people to kind of be realistic of the outcomes that you want. I want people to be realistic about planning ahead. I want people to be realistic about, doing your research. I want you to do your research. Do your due diligence to make sure that you're picking the right doctor for you. Because just because he's the right doctor for me doesn't mean he's the right doctor for you. And make sure you want your outcomes. How you want your outcomes to be. When you come home, I think it's very important. Your fahas. That drives me crazy when I see people who've had these surgeries before and they don't stay in their fahas. The faha and the massages is what's going to mold your body. So you need to make sure that you when you go down there, I would suggest anyone to get 2 fahas. And let me explain this, because I think people get confused about this when they're going down from their faha. When you come home from surgery, you're going to be in a faha. That's the one that they're going to put you in when you come home from your surgery. Once you go to your post-op appointment, and by the time you go to your post-op appointment, I don't remember exactly. I think I might have did my surgery. I might have had my first massage right after my post-op appointment, or before. I'm not for sure, but right after that thing was too big. And so if it's too big and it's too loose, it's not giving you the compression that you need on your body. The faja is designed to compress your body and to mold your body. So when you have this faja on, you have to remember, you're going to have a faja on, you're going to have an abdominal binder on, a board, a back board, and you're going to have 3 sponge boards, 1 in the front, 2 on the side, a backboard, and then you're gonna have an abdominal board. And this is all gonna be tucked into this faja. So what you need, I got two. I ordered two fajas. And so it wasn't a faja 2 or faja 3. It wasn't like that. Your first faja is the one that they're going to give you at the hospital. And then when your second faja, you need to get at least 2 of them, because you're going to have to wash these. You're going to have to take these in. These are going to have bodily fluids on it. So, of course, you're going to have to wash them. And then while you wash them, what are you going to do to keep the pressure on your body? Now, another little hack that I did to keep pressure on my body, if I didn't have the other one, back from getting taken in, is I kind of wrap my body in, I'll think of it in a minute, but bandage, Coban. I wrap my body around with some like Coban around my stomach or whatever, and to kind of give my body the compression that it needed until the faja was ready to be put back home. And then I also have like the tape methods and different things like that. I didn't know how to do that, but some of the massage therapists, licensed lymphatic massage therapists. I need to quit saying massage therapist. I need to say lymphatic massage therapist. They know how to put the tape method on you, so that way you can kind of also have that while you have the faja on as well, to give you that extra compression that you need. But when you're getting the faja, my faja when I got out of surgery was a 3X. So I bought 2 3Xs. So once I got those done, when one became, so it's going to be 3 links. So, of course, when you first put it on, you're going to be so big, swollen, you're going to start at the first link, and then you move in closer, tighter and tighter once your body can handle that, and once you start, losing the fluids and things. So the reason why you don't say, okay, if I'm in a 3X, I'm going to go by a 2X. You don't do that. I'm going to tell you why. Because when you go down like that on your faja, you are going, that means it's smaller, and that means it's going to be smaller around your butt. And if you have a BBL, and if you're going to put that extra pressure on your butt, it's going to kill your fat cells. So that's the fat cells are where he takes your fat and moves it there. So you're going to kill the fat cells if you go down on your faja. So what you don't, that's not how you do it. Your faja is just taking in from here to here, right where your abdomen is. And sometimes you can find a seamstress who's really good. I think that was in Atlanta when I found her. And she can take it in just in the front, so you can get that fupa and push that fupa in. But you only get the faja taken in from here to here if you have a BBL. So you don't want any extra pressure on your behind, because it's going to kill the fat cells. So you're not going to keep all those fat cells. After your surgery, when you get through and off that table, that's in the picture, oh my gosh, your butt is huge. It is like, oh my gosh, like almost, be honest, it's like carrying a midget back there. I was just like, oh my God, what did I do? I hope this goes away. I mean, I got to lose some of this, and you want to, because it is huge. But like I say, you don't want to lose all of it, but you do want to lose some of it. So again, when you get your faja, get your 2 fajas. So that way, when one's getting taken in, you can have the other one on. When one's getting washed, you can have the other one on. You can't put it in the wash. This is something that has to be washed by hand, and then you can hang dry. It takes a while for it to dry, so therefore you're going to need 2 fajas. So stop being cheap. You went in there and you pay for the surgery. Go somewhere where they're licensed, and they're going to take care of you, and they're going to feed you the right foods. I see people in there after they had their surgery, they're eating shrimp. Shrimp is high in sodium. Sodium, what does that do? That blows you up. You don't want to do that. You want the opposite. You want to eat foods that's going to help you get rid of the swelling, help the inflammation go down. Look it up. It's called an anti-inflammatory protocol diet. Look that up. Those are the type of foods that you need to eat to keep the inflammation down. That's what you need to, those are the kind of places you need to go. Go to places who are serving food to you that are designed to, not high in sodium, but designed to decrease your inflammation. So that's another way to tell if you're going to a good recovery home, if they're serving the right foods, if they're pushing fluids. When I went to Nurse Joe, so she pushed fluids. So she called it a mean green, and it had pineapple juice, which pineapple juice really does decrease inflammation. She had some other things in there, but let me tell you, I'm gonna go back to this. When I finished with having this procedure done, I asked myself, I was like, why did you do that? What possessed you to do something so crazy? Because it hurt so bad, but it was something that I signed up for, something that I wanted to do. So I had to, deal with it. But I was not thinking as a nurse. I was thinking as a patient. And so I went to Nurse Joseph's house. They picked us up. And honey, I was going crazy. Hey, she grabbed me by my shoulder. She shook me. She said, hey, bring it together. Pull it together. So that's why I say it's different when you go and you let your mom and them take care of you, and they're going to baby you and let you do this and do that. You need someone who's going to give you the foods that you need to get, that you need to have, someone's going to make you get up and walk. You can't have this surgery and not get up and walk. You have to walk. You have to have your compression stockings on. You have to get up and you have to walk. You don't want to suffer pneumonia. You don't want to suffer any DVTs. You have to get up and you have to walk. That's why it's important to me. I think it's important, and it matters to me, to go to someone who is not, don't go down there and have family take care of you. Because family, your mom and your boyfriend, they're going to baby you because you're going to be crying. You're going to be whining and you're going to be hurt. But if you go down there with someone who's licensed, they're going to say, no, you need to get up and walk. No, you need to keep your compression socks on. No, you have to lay on your stomach. So you need that, especially in the first couple of days, because your body's get adjusted to this new change. So, and once after you get adjusted, you'll be better. But in the first couple of days, you need that person there who's going to be able to not strong arm you, but someone's going to be strong, because at that point you can't be. You're not thinking as clear as you would if you were not the patient. So again, like I say, that's just my little, from what I've been through with the surgery and what I know about it. And I've enjoyed my outcome. It's been years since I've had that done. And I just want, when people come to me, I'm going to always be able to educate you on different recovery homes. I want to educate you on going to license. I don't know any right now that are here in Dallas. As far as, I do know a licensed lymphatic massage therapist, but I forgot her name. You can probably inbox me later on and I'll be able to tell you her name. And let me tell you, she's booked up, she's so booked up. I think she has a couple people working for her since I think last time she did, but I forgot her name. But I can definitely find out for you and I'll be able to inbox it to you. But she's licensed and she's good and she's booked and busy. When I tell you, people plan ahead. No one's waiting to the last minute to get their massages done. They're planning ahead to get all this done. So I want you to do that too. I want you to have the best outcomes. I don't want you to come back home and have to go back to Miami because you didn't get an infection or this and that didn't happen. I want you to, especially you coming to me for a pre-surgery clearance, I want you to have a good experience, because I had a great experience, and I want everyone to have a great experience and have the results that they want, and everything works, to work out great. So like I say, I don't have her name in particular, but I'll be able to give it to you later. If you inbox me or whatever, I'll be able to tell you who she is. And I don't know any recovery homes here in Dallas. I think, no, it's one called the Dallas Recovery Home. I think that's what it's called. I'm in their group, and they're here in Dallas. I don't really know any of them. I'm assuming they're licensed. I have not checked to see, but you more than welcome to do that. I mean, I would if it were me. But I think it's called Dallas Recovery Home. I'm not, like I say, I'm not for sure or not. But you can always inbox me and I'll be able to tell you. But that's who I would go to for that. And I don't know of any other recovery homes here or any lymphatic massage therapists here. I wish I did so I can tell you about them. But I'll find out that one person's name for you. And then once you finish with your lymphatic massage therapist and you get ready for wood therapy and cavitation and things like that, it's one. Her name is Aaliyah. She'll come to your house. She'll come to wherever you at to do that. But you can't get that done until you're 3 months, 3 to 6 months or so post-op. I'm not for sure which the number is, but post-op you can't get that. I mean, you couldn't handle wood therapy right after surgery, so it's gonna be a couple months after you have your procedure to get this wood therapy done. Her name is Aaliyah, and she is on. I will tag her on here, and she's on Facebook and Instagram, and she will come to your house. She does the cavitation and everything. I still go to her to get maintenance done once a month, sometimes, or every couple months. But I still try to maintain because you still can swell up. I don't care how long after you've had the procedure done or whatever the case may be. You can still swell up. So it's still, like I say, you need to continue the maintenance on your body. It's just not, you can eat what you want to, and it's going to maintain. No, it's not going to stay that way. Are you going to be someone who's going to go down there who's going to return and keep returning? I don't want to go back. I didn't want to go back. So therefore, I decided to do the things that I knew I needed to do to keep my body looking the way I wanted my body to look. Have I gained, have my waist, was my waist smaller right after surgery? Yes, my waist was much smaller, a year or so ago. But, life happens, things happen. Do I want to go back? No, I don't. I'm okay. I'm good at it. But that's what I want to say about the surgery. So I gave my spiel on that. And what I've been through, all I can tell you is what I've been through, what I've seen. and the things that I've heard, and I'm just giving you my suggestions on what I would do if it were me. If I had to go back and do it all over again, I would go the same route that I went. I would not cut corners on this. This is not something to cut corners on. And then, you know, when you see the girls and they look, and their surgeries look really, doesn't look as good, it's because, hey, maybe they didn't pick the right doctor. You know, like I said, you have to have the right doctor, you know, that's designed for your body, you know. Every doctor's not going to be good on big people. Every doctor's not going to be good on little people. It's up to you to do that research to find that out. Let me see what else I wanted to talk about. I think that's really all. So I hope that my story, my live, helped people kind of figure out which way to go in their surgery journey. And also another thing, you can tell you about these surgery sisters. Be careful when you're getting surgery sisters. People are always trying to scam people. I don't know why people don't want to go to work every day. But, you know, I was on there in a group, and I was on there trying to find me a surgery sister because I didn't want to go through this process alone. And I didn't want, you know, I wanted to like talk to somebody and, you know, and have someone go down there with. But it seems like every time I get ready to do something, I'm always doing it by myself. But I had someone, she was like, okay, I'll book the room, this and that. And, you know, and you think everybody's going to be, you know, everybody's here for the same reason. They're trying to do good. That's not the case. And so basically she's like, hey, I'll pay for it. You know, everybody, you know, just cash out me the money for this and that. And she basically took the money, but she ended up giving it back. But still, it's something that, you know, be careful when you're dealing with surgery sisters, because everybody's not there to have surgery. Some people are there. It's just like how they scam for everything else. They scam for this too. I have no idea why people wake up and just start scamming people, but it happens. It happens on everything. So it even happened with surgery sisters. So be careful with that. So again, if you're looking to get a pre-surgery clearance or a preoperative surgery clearance, the same thing. And you're going to, like I say, any surgery center here in Texas or Miami or wherever you're going to go to, and you live in Texas, I can do the pre-surgery clearance for you. We can upload. I give you, you book your appointment. Once you book your appointment and I confirm your appointment, I will send you a portal so you can have your access to it. You create your username and password, and you can upload your information. I can upload your information, and then you can also message me, and we can be able to communicate that way. So again, this is I'm Shayla. I'm a nurse practitioner here with Evolve Wellness Anesthetics here in Carrollton, Texas. Again, I just went over my pre-surgery clearance new service that I'm going to offer, and just kind of talk about that, and just talk about, you know, the outcomes of you know, how the process works as far as having any type of cosmetic surgery. And again, you know, don't let people discourage you. You know, this is something that you want to do. Do it for you, you know, and do what's best for you. Do what makes you happy. If you don't like something about yourself, go and change it. Don't worry about what everybody else say, because trust me, everybody's going to always have an opinion. Girl, it is. I want to done this. Or, I believe in natural bodies and all this. Well, you know, everybody has their opinion. You can't get mad at it, because in this case, you're going to be mad all the time, because trust me, everybody's going to talk about it. Everybody's going to be as soon as you post a picture on Facebook, they're going to be all in your inbox. And then the women, for some odd reason, they can't congratulate you in front of everybody, but then they give me an inbox and say, "Oh, your body looks good. Who did it?" But why, you know, if you gonna give me my flowers, give my flowers in the light. Don't give my flowers in the dark, because if you have something that I like about you, I'm gonna say, "I like that. It's pretty. Who did it? This and that, that and that." I'm not gonna have to just be sneaky and inbox you to say, you know, I'm a woman, and I want everybody. I want everybody to win, and I'm a black woman. I want everybody to do good, especially black people. You know, do good, you know, and if you get something that you like and something I want to know, I'll tell you right there on your picture. I don't have to inbox you to tell you you look good and who did this and did that. You know, I don't like, you know, I hate when people do that. If you want to know about something, just, or someone is cute or something, just say it. Don't inbox somebody and then say it so everybody else can know that you don't want everybody else to know that you think it's cute. You want to get it done. Everybody's getting this done, but I just want people to do it safely and to just do your research about it. Make sure you're going to the right people. Make sure you're going to licensed people. Like I say, some of these doctors don't be licensed. And especially, and just because someone says they're a nurse, that don't mean that they can do lymphatic massage therapy. They don't mean that. We have it's called, like I said again, your scope of practice. We need to stay in, as a nurse, we were taught to stay in our lane, not to go in somebody else's lane, because that's when we are not, that's where we're not safe at. We're not insured in somebody else's lane, but in our lane, we're insured. So again, if you're looking for someone to give you, do your preoperative surgery clearance, come to me. I can tell you whatever I've told you on here. I can tell you. I don't mind talking to anybody about it, educating you about it, because I did my research, so I feel like I can give you the education, give you answer some questions that you may need answered. If I can't, I'll go and I can find the answers or find somebody who can answer it for you. So I hope this helped somebody. And again, when you get ready to have your pre-surgery clearance, book with Evolve Wellness and Aesthetics here in Carrollton, Texas. Again, thank you guys for your time, and I hope this video was helpful. Have a good day, and let's evolve.